Hi, my name is Rupal, and I am a registered nurse in the state of Texas and Illinois. In today's episode, we're going to talk about something that confuses a lot of people: patients, families, and even healthcare providers. In what situations would a patient not be eligible for palliative care? And just as important, when does that change? Now, this question comes up often because palliative care is not a single moment in time. Patients move through phases. There are days when things feel manageable, and then there are days when it feels like no matter how hard you try, you are taking one step forward and two steps back. Eligibility is not about a diagnosis alone. It's about how the illness is affecting your daily life. Let me walk you through an example. Let's say you have had kidney disease for past 10 years. This is related to type 2 diabetes that you have lived with for over 40 years. Now, for a long time, nothing really changed. You worked, you lived your routine life, you managed. Then about a year ago, you were told your kidney disease has progressed to stage 4. And now you need a dialysis twice a week. This is serious, but in your mind, it feels like just another challenge you'll handle. You have a very supportive family as well. Everyone is on board. If you request a palliative care consult at this point, you may not qualify yet. Why? Because when the palliative team assesses you and asks you a question, you might say, I'm driving myself, I'm doing my daily activities, I have some shortness of breath, but it's manageable. Overall, I'm not bad. Now, your symptoms are still being managed by your kidney doctor or primary care provider. There's nothing unrelieved at this point. So, at this stage, you may not be eligible, and that's okay. Now, let's see what happens next. You're still dealing with a serious illness. Your quality of life is not the same as it was 10 years ago or even a year ago. You now experience shortness of breath with basic activities. Fluid is building up in your body. You feel slowed down and exhausted. Dialysis is no longer just an appointment. You're sitting in that chair for 3 to 5 hours at a time. After dialysis, you're wiped out. You need help for at least a day afterward. Family starts stepping in more. They're not complaining, but their routine is changing as well. You feel a little better for a day or two, and then it's time for dialysis again. This continues for weeks, then months. Family members begin rotating responsibilities. Now it's year 2. Dialysis has increased to 3 times a week. Fluids build up faster, shortness of breath worsens, fatigue increases, weakness limits what you can do. If no one has suggested palliative care in the past 6 months, this is the time to ask for a consult. You may not have been eligible before when you were at stage 3, or when dialysis first started, or when rest helped you recover. But now you're eligible. Why? Because you have ongoing symptoms that are not fully relieved, even though the treatment continues. And here's the key point. You do not stop dialysis. Palliative care does not replace your kidney doctor. They come alongside. They assess, can the medications help ease shortness of breath? What can they prescribe? Can fatigue be better managed? Are there community resources to support the family? Is there a volunteer service that can ease family burdens? This is what palliative care is meant for. Eligibility for palliative care is not about giving up. It's about recognizing when symptoms and support needs change. In upcoming episode, we'll walk through more real-life examples that families face every day and talk about when palliative care fits and when it doesn't. If you have questions, please leave them in the comments. I will do my best to answer. Thank you for being here. I'll see you next time.